One of the greatest difficulties any athletic trainer faces with concussions is having to decide when the athlete is capable of returning to play safely. This section of our presentation will focus on different tools and exercises that an athletic trainer can use to accurately determine if their athlete is ready to resume competition. One of the most common tools used today to determine an athlete's overall cognitive function is a computer program called Impact. This program runs an athlete through a variety of tasks that can be objectively measured to calculate an athlete's overall mental status. Such things as reaction time, visual and audio memory, and central processing speed are all measured with this program. Comparing results of post-concussion testing to baseline testing can give the athletic trainer the ability to determine how far away their athlete's cognitive status is away from normal. The next tool that we will discuss is the balance error scoring system. This clinical tool is used to determine an athlete's static postural stability, which is something that can be compromised following a head injury. The athlete is to perform 3 different stances while maintaining correct posture. They should stand up straight, place each hand on their iliac crest, and keep their eyes closed for the duration of each test. The athlete will progress from a double leg stance to a single leg stance and finally a tandem stance. Their non-dominant leg should be used for the single leg stance, and this same leg should be positioned behind their dominant leg during the tandem stance. Once the athlete has performed these stances on a firm surface, they will progress and perform these same 3 stances on an unstable surface. The unstable surface used here is a typical AirX pad. There are 6 major errors that the clinician should look for when scoring this test. They consist of the athlete moving their hands off of their hips, opening their eyes, stepping or stumbling, abduction or flexion greater than 30 degrees at the hip, lifting the forefoot or heel off of the surface, or remaining out of the proper testing position for more than 5 seconds. If multiple errors occur simultaneously, only 1 point is given. It is not until the athlete resumes the correct posture that he or she can be scored against for another point. If the athlete cannot regain correct posture in 5 seconds, they will be given the maximum score, which is 10 points. Each testing stance should be performed for only 20 seconds. The errors should be added together and compared to the athlete's baseline testing score. After several days of rest and a complete resolution of concussion-like symptoms, the athlete may begin to participate in physical activity. Certain symptoms that an athletic trainer should be mindful of are headache, nausea, sensitivity to light, or memory problems. The first few exercises that the athlete participates in should be fairly easy and short, such as walking on a treadmill or riding on a stationary bike. If there is no reproduction of symptoms while performing these exercises, the athletic trainer can progress the athlete to treadmill running or jogging. It is important to ask the athlete how they feel before, during, and after participating in these activities. It is also important to emphasize the importance of telling the truth to your athlete, because premature return to play after concussion can lead to permanent brain damage or even death. The final step before your athlete can return to full participation is a progression into sport-specific movements or activities. These activities should be performed at a higher intensity than the exercises mentioned previously. If there is no reproduction of symptoms during these activities, then your athlete is ready to take the field during practice. It is important to monitor your athlete before, during, and after practice for any concussion-like symptoms, and it is also important to follow up with your athlete if they have come across any situation where they might have sustained another head injury.